is a very, very sudden change in behavior in a child. So sudden onset of severe anxiety, OCD behaviors, food refusal, bedwetting. There's lots of different types of things that can happen. Along with it, also a change in handwriting after an infection.
Hello, I'm Dr Jodi Richardson, and you're listening to Well, Hello Anxiety, a podcast where we end the struggle with anxiety and build our toolkit of practical skills to thrive. Hello, lovely listeners. Thank you for joining me for another episode. Would you believe it is take 4 on the intro for me today? It's Monday morning and I am absolutely delighted to introduce you to today's guest, Dr Leila Masson. She is a sought-after expert, internationally renowned consultant paediatrician specialising in nutritional and environmental medicine in children. She's also part of the teaching faculty of the Australian College of Nutritional and Environmental Medicine. She had a busy clinic in Auckland for 14 years before moving to beautiful Sydney here in Australia in 2016, where she continues to work with children and families. She's worked in the US, Europe, of course, New Zealand, and volunteered for 2 years setting up a rural clinic in Pakistan. She's the author of Children's Health A to Z. She's just released some training with ACNEM, with the Australian College of Nutritional and Environmental Medicine, which she'll talk to us more about. And she's here today to talk to us about PANDAS. So, Leila, thank you for joining us.
Hi, it's a great pleasure being here. Thank you for inviting me.
Oh, thank you. And thank you for your patience with my introduction this morning. Oh, thank you again. So Dr. Leila Masson came highly recommended to me from somebody who I was chatting to the podcast about, and she asked me the question, have you done an episode on PANDAS, which has a second name, PANS, which Leila will explain for us. And I said, no, look, this isn't something that I've researched before or understood. And so that's what's led me to interviewing Leila today. So Leila, could we please start by learning? Could you please help us understand about PANS and PANDAS? What is it?
Yes, I'd love to tell you about PANDAS. It's one of my passions to let people know about it. So what it is, I'll tell you later what the name means, but it is a very, very sudden change in behavior in a child. So sudden onset of severe anxiety, OCD behaviors, food refusal, bedwetting. There's lots of different types of things that can happen. Along with it, also a change in handwriting after an infection. A lot of kids also develop tics, like eye blinking or throat clearing. And what I have found in my practice is that a lot of children with PANDAS are actually misdiagnosed as either Tourette's or autism or ADHD or just anxiety, when in fact it's something that can be treated. So about 30 years ago, doctors in the United States noticed that some children, after they had a streptococcal infection, like a strep throat, developed a sudden change in behavior and mood. So this sudden change, it's really a dramatic change. It's not like over several months, a child slowly gets anxious. It's from one day to the next. And for a long time, we've known about autoimmune diseases after strep infection. So you may have heard of rheumatic fever, where children get a strep infection and then antibodies that react against the strep and trying to kill it off are cross-reacting with the heart and actually destroying the heart valves. So that's called rheumatic fever. And these children are treated with antibiotics and actually have to stay on antibiotic prophylaxis until they're 18 at least. And then some of the researchers who were working with these children noted that some kids had mental health issues like anxiety, OCD. And then they realized that there was a whole different group of kids who didn't have the heart problems, but who had the mental health issues, the behavior issues. And so it was called PANDAS, Pediatric Acute Neuropsychiatric Disease Associated with Streptococci. And then over the years, people found out that it's not just strep, that can cause this, but any kind of infection. So some kids may have mycoplasma or herpes, or some other virus, influenza, COVID, definitely
Wow.
as well. Glandular fever. So lots and lots of different bacteria and viruses can cause this acute change in mental health, an acute onset of anxiety. And so now it's called PANS, Pediatric Acute Neuropsychiatric Syndrome. So that encompasses PANDAS with strep, but every other cause as well.
Oh, you have explained that so beautifully. And I know that there will be listeners who will be maybe feeling a little bit anxious because they've learned that there are a whole range of infections that could bring this on with children. And for parents listening who might be anxious, their minds might be going to, as mine was, well, what's the likelihood of one of our children starting to show signs of PANDAS? Will we refer to it in the podcast as PANDAS or PANS? How would you like to
Or we
refer
can
to it?
just call it PANS.
PANS,
That makes
okay.
it easier. Less of a
Yes.
tongue twister.
Less of a tongue twister, yes. And although, like you said in one of your blogs, that PANDAS makes it sound cute and cuddly and endearing, but it's anything but from what you've just described. I mean, look, as I mentioned to you before, and as listeners know, I live with anxiety and I have had many challenges with OCD across my lifetime, and it's not, I'm medicated now and it's not a part of my lot, thankfully now, but it's extremely distressing for the child, very, very difficult for the family. How common is it?
So it's estimated to happen to about 1 in 200 children. So
Goodness.
it's not super common, but it is common enough that you can probably expect that every school has at least 1 or 2 children like that. And most people don't know about it. So if your child, suddenly becomes anxious and OCD and has intrusive thoughts and refuses to eat, it would be, it's more likely than not that your doctor hasn't heard of PANS because it's relatively new. It takes a long time in medicine for new research to filter through to the community.
Yes.
But if your GP has heard about it, or your pediatrician or your psychologist, then you're very lucky because it's very easy to treat, actually. So what happens with PANS is that, so there is an infection, let's say, for example, a strep infection, and whenever you have an infection, that causes inflammation, right? So just think of, if you have an inflamed knee, it gets big and swollen and hurts, right? And so you have that in your throat, and then that inflammation actually travels along the olfactory nerve, which is a nerve that you use for smelling,
Yes.
to your brain. And it goes to the basal ganglia, which are parts of the brain that are in charge of emotions, but also of movements. So when you think of Parkinson's disease, that affects the basal ganglia. And you know that people with Parkinson's, they shake and they can't move really well. So PANS is very different, but it affects similar areas of the brain. And then those areas get inflamed and you get the movement problems. So like tics, some kids have big movements, some kids become very, very hyperactive and they can't stop running. So I've had patients who would just run in circles all day. They were running, and at night they would move their legs all night. I mean, this is not the common presentation, but there are some kids like that. And but tics are quite common. Yeah, so eye blinking, snorting, throat clearing, jaw stretching, neck stretching, you name it, any kind of tic. And so that's the movement part. And then the emotional part is the anxiety, the OCD, the intrusive thoughts. And another part of the movement symptoms is a very typical thing is that these children have an acute change in their handwriting. So children who were able to draw beautifully or write beautifully suddenly just scribble. They can't write clearly anymore, or they do it very big or very small. And it's just a really impressive change. I mean, it's significant. You see it. You look at the handwriting from the week before and the week after, and it's very, very different. And that's actually a really good way of monitoring a child who has PANS, because PANS can go up and down. I mean, we'll talk about how it's treated in a minute, but it can come back. Very often it does. It comes like little flares or big flares, so you treat it and then a few months later they have another infection, or their sister or brother has a sore throat, and that alone is enough to trigger the immune reaction in the patient, in the child, and they have another flare. And often one of the first symptoms is a change in handwriting and a new onset of wetting themselves during the day or at night. So kids who were dry before suddenly have, accidents again. And we work, of course, very closely with the family and the teachers, and tell the teachers, look out for those symptoms. If the child suddenly changes their handwriting and asks to go to the bathroom more often or starts wetting themselves, let the parents know, because that's maybe the beginning of another flare.
Yes, it is. Now that you've described what we could observe if this was happening to one of our children, or for teachers having this happen for one of their children in the classroom, it seems like it's with the right understanding and an understanding of PANS, that it could be picked up quite quickly, understanding the combination of symptoms and signs. And it's so relieving to know that it's easily treated, that you said that it can be treated, that there can be flares that can come back for various reasons over time. But once it's been treated, if the flare comes up, the family knows where to go and what to do and who to seek help from to get the treatment back in action again. Could you please let us know what age groups you typically see these presentations in, and what are some of the other signs and symptoms that parents and teachers could look out for?
Yeah, so when we first worked with PANDAS, the streptococcal type, it was said it was school-age children, preteens, so 5 to 14, 5 to 12, something like that. But with PANS, there's actually no age restriction. And I have had patients who had an onset in retrospect at 3 months after an infection, where there was a real change in the baby's behavior from 3 months. They had been settled and happy and lovely, and they had an infection at 3 months, pneumonia or something like that, and then they completely changed, and then intermittently became like that again until it was finally picked up what it was. So there is no age restriction, but typically I would say it's between 4 and 14. That's kind of or maybe even a bit earlier.
Right.
So a bit, young, 4 to 12 would be the typical onset. There are people who have an onset as teenagers or as young adults, but it is less common.
Yes. Yes. And what would parents of really young children observe? Like a child that maybe wasn't handwriting yet, or they're
Mm,
kind of scribbly, whether they've,
yeah.
had an infection and struggling with PANS or not, they haven't got that sign. And the child might not be able to articulate kind of what's happening for them in terms of their thinking and things. What sort of behaviours might parents see?
So it's, of course, very hard in these young children to diagnose something like that, because there's also no blood test that proves that you have PANDAS. There
Right.
is one test available in the United States called the Cunningham panel that actually looks at the antibodies against some of the brain areas and brain cells, but it's not accepted in Australia, and it's very, very expensive and difficult to do. So I don't recommend that test.
Yes.
But with young children, I would say the typical thing is rages.
Right.
Yeah, kids who just become have huge meltdowns, become so angry, and the problem is that we expect that in toddlers, right? The terrible twos, we expect kids to have meltdowns, but not to that degree where they're just inconsolable, and
Yes.
and just throw themselves on the ground for hours. Yeah.
Mm.
And then often you have some other symptoms along with that, right? So the food refusal, that's very, very typical. So, and the OCD, things have to be just right. And I understand why these kids often are diagnosed as autistic, because that's, of course, some of the things that we see in kids with autism.
Yes.
They're very, very picky eaters. Everything has to be just exactly the right way. But so it's not an easy diagnosis to make at that young age. And I would say all the kids I know who were diagnosed or who had an onset that young were diagnosed years later.
Yes.
And they were able to then tell us about their intrusive thoughts, about their OCD, habits, and the sensory issues. That's a big one as well. When they
Right.
suddenly don't want to wear clothes or get really sensitive to the seams in socks or shoes, or washing hair, or uh, any kind of sensitivity, is very sensitive to smell suddenly. That can also happen typically with PANS.
Yes. Yes.
So
And it's the abrupt onset, isn't it, that can be so indicative as well. And how abrupt? So you said it actually at the beginning, from one day to the next.
yeah, so typically it's within a couple days, or one
Wow.
day. So parents can often remember the date and say, my child on that day changed and wouldn't leave the house anymore, too scared to go outside, has been inside the house now for a year,
Oh.
which causes, of course, another whole set of problems, including vitamin D deficiency, which is not good for your brain.
Yes.
So, yeah, it is. That's part of the definition, the abrupt onset.
Yes. Oh, you've shared so much that will really make. I imagine if there are listeners who are going, "Oh my goodness," there will be some who are having this epiphany right now as they're listening to say, "Oh my goodness, perhaps this could be what we're dealing with, or what friends they might be connected with are dealing with, or maybe a teacher might be working with a family, and others will be going, "Yep, we've been through this, we've been down this road, and yes, I can remember that date." And it's terrifying for parents when their children's mental health changes, and when these, especially with big emotions, because it's so easy for us to kind of, have that contagious nature of those emotions, and to know how to respond and what to say and what to do. And so how do you said earlier, of course, a huge part of what you do is supporting the family, and that's a really big part in the treatment for the child as well, I imagine.
Absolutely. I mean, we all know that parents can only be as happy as their least happy child, right?
Yes,
So if
yes,
there's a child in a family who's suffering, the whole family is suffering. And, whether the child is anxious or rageful, it does definitely affect the family in a very stressful way. And the family, I always recommend psychological support. They need to see a psychologist who can help the child, maybe with some CBT, cognitive behavior therapy, for the OCD and anxiety, but also the parents on how to manage the child. I think when a child is suffering, their behavior may come out as quite aggressive or angry or violent even. And then the first reaction is not, oh, I love you so much and I want to help you. Some parents' first reaction is, I'm getting angry now because what you're doing, I can't stand it. And you really can't react like that to a child who's suffering. There is no
yes,
benefit in getting angry at them. So, the treatment really is to be super loving and have
yes,
lots of empathy and understand what they're going through, even if it's super difficult for the parents to do
yes,
that. And that's where the parenting support and the behavior management comes in to, walk away rather than getting angry, or just, say, I love you so much. I can't stand this behavior. I'm going to take a minute to just do some deep breathing. You can come with me if you like, or you can stay here.
yes.
One thing I wanted to mention, which is a really good clue as well for this, is that often one of the parents has an autoimmune disease, and very typically the mother has Hashimoto, which is an
Right.
autoimmune disease that affects the thyroid gland.
Yes.
So it's, of course, not always the case, but very often, or rheumatic fever or celiac disease, any of the common autoimmune diseases are usually somewhere in the family, because, you have to have a genetic predisposition to get any disease,
Yes.
including PANS. And then you have the environmental trigger. In addition, the infection, right? So not everybody who gets a strep infection will get PANS. And on the other hand, of course, also not everybody who is anxious and angry and is OCD has PANS. There are kids who don't. And
Yes.
so Do you want me to talk about how we figure out whether it is or not?
Yes, please. Yes, go for it. Perfect.
Okay, so it's very easy actually. You reduce inflammation in the body to see whether inflammation in the brain is causing the symptoms.
Right.
And you just do that by giving ibuprofen or Nurofen, same thing, 3 times daily for 3 days.
Huh.
So that's at the regular dose for the child's weight. And if the child becomes much calmer, significantly happier within those 3 days, then you know that inflammation is causing the symptoms.
Goodness
And
me.
then the next step is to see how to kind of put out the fire of the inflammation, right? So you can't
Yes.
give ibuprofen long term. It's not healthy. You can
Yes.
get gastritis from that, and it's also just a band-aid. But it is a very,
Yes.
very good way of figuring out whether you are dealing with brain inflammation or not. And then the next thing really is figuring out what infection is causing it. And if it is a bacterial infection, you give antibiotics. So
Yes.
either, amoxicillin or augmentin. In America, mostly azithromycin is used. We go kind of here in Australia, we usually start with augmentin,
Right.
give a 10-day course and see how the child's doing. So children who've just had their first episode of PANS and respond well to the ibuprofen, you give them 10 days of augmentin and they usually are recovered. They do
Oh,
fine. And then you need to kind of, work on the immune system to make sure this doesn't happen again. But the problem is children who've had it for 2 or 3 or 4 or 5 years, I have had patients who hadn't left their home in 2 or 3 years because they're so anxious and OCD. And then most of the time, a 10-day course of antibiotics won't do it. They need a longer course and they need prophylaxis. So once you get them well, once you find the antibiotic that works, if augmentin doesn't work, then you try another one. Then I often go slowly down. If they were on twice daily antibiotics, then we go to every other day for a week. And if they're stable on that, then we go to twice a week. If they're stable on that, we stay on once a week for a few months just to make sure it doesn't come back. There are stronger medications that can be used. So if the ibuprofen doesn't work, then you can use steroids. You know how children who have asthma or bronchiolitis often get a 3-day course of Redipred?
yes.
So the same medication can be used and it's stronger than ibuprofen. So you can give a 5-day course of a steroid just for the same thing. You just give that once a day and just see whether the child becomes calmer and
Yes.
changes. The problem with steroids is that some children become angrier on it. So if you already have a child who's quite violent and angry, I'm not so eager to put them on steroids then. So I may just, go straight to the antibiotics after the ibuprofen.
Yes.
I do some blood tests, and there are, you can check for streptococcal antibodies, you can check for other infectious antibodies to see whether they have it, like glandular fever, mycoplasma, those kind of things. And you can check, for your immune system to function well, you need good levels of iron, vitamin D, zinc, omega-3. So those things can be tested and supplemented if they're low, and they do help. They do help the brain function better. They help the immune system function better, but they're not a diagnostic. They don't, if you're low in iron, that doesn't mean you have PANS at all. It's just that a lot of kids are low in iron, especially if they've been chronically ill.
Yes.
And if they're not eating much because they're refusing food.
Yes.
And you can check inflammation markers, you can check some immune markers, but there is no test that clearly says it's PANS. Yeah, if you have a very, very high antibody to streptococcus, makes it more likely. Yeah,
Right.
but you
Yes.
still have to try the treatment and see what happens.
Yes, it's like anxiety itself. You can't do a blood test and determine if someone has anxiety. You're looking at a whole collection of signs and symptoms, behaviors and observations, and then ticking boxes isn't the right expression really, but it's a checklist, isn't it, as to when there's a diagnosis for PANS. I imagine that you've got a checklist of, well, these are the things that would contribute, and then you can start the treatment. And like you say, that the treatment of 3 days of thrice daily ibuprofen could result in a big change, then that's a fairly non-invasive type approach, isn't it, to get a fairly quick answer for
I would
something
say it's very, very safe, right? I mean, unless you have an
Yes.
allergy to ibuprofen, giving it for 3 days is not risky.
Yes,
Yeah.
that's right. And so given that, and I have just a little quick aside. Our daughter, she broke her. I'm sorry, I'm not laughing because she broke her arm, but she's broken her radius and ulnar. This was years ago, and she was on. She had to have a lot of ibuprofen for the pain, and then she broke her thumb, and she ended up with some gastric issues. We had to have gastroscope and biopsies, and there was a lot of time off school. And so when I sort of think back and wonder whether or not the ibuprofen may have contributed to her gastric problems. So I'm ultra cautious now because of that, because we have got that history. And I wondered, could parents listening, could they try this, or should they seek advice from their GP first to say, look, I've listened to this podcast. I've heard Dr. Leila Masson explain this is an approach to test. Is this something that you would recommend parents just could try of their own volition, or would you recommend that they see their GP and sort of work together with that part as part of a medical team?
I think it's a good idea to try the ibuprofen at
Yes.
home, because
Great.
you may be waiting to see your GP anyway for a few days, and you've done it.
Yeah.
And if it works, you can already say, look, this worked. And here's the website, the PANDAS network.
Yes.
Please look this up. There's a flow chart on there that shows you what to do. And I think my child has this, and I'd like to see, if treatment works. And could you please look at this? I think it's a good idea. I mean, you do need a team of health practitioners, right, to work with that. You can't get antibiotics on your own.
Yes, of course.
And I think it's really important to have someone overlooking the whole thing, because of course there's lots of other things that can cause OCD and anxiety, and you want those ruled out. I've had a child who had lead poisoning, who had
Goodness.
anxiety and OCD, and when the lead came down, all the symptoms were gone. So you kind of want to check other causes of this, but
Yes.
I think giving 3 days of ibuprofen is very safe.
Yes.
And the other thing your GP can do for you is do swabs of the child's throat and nose, to look for strep and for staph as well. And then, you also get sensitivities with that. So you actually know which antibiotic will work if they find one. And so that's very often where the strep is sitting, right, on the tonsils or staph in the nose. But I also find that a lot of kids are sitting in their gut because they already had like several strep throats in their life, and they swallowed some of the bacteria. They had antibiotics, but some of the bacteria became resistant, and they're sitting in their gut. And if you do a stool test, that's probably not something your regular GP will order, but there are some, there's a huge amount of research now on the microbiome, on the gut flora, and its relationship to anxiety and to mental health in general. And sometimes when you do a comprehensive stool analysis, you will find that there's some bacteria that are really overgrowing in your gut that shouldn't be there. And for example, it could be strep, but it could also be lots of other ones. So that may be helpful. But doing swabs is a good first step. And if your child has a very red bottom, so if the anus is really, really red, then they can have what's called perianal strep.
Right.
And that's part of PANS. And then they can do a swab of that and see if they find strep, and that, and give antibiotics for that.
Oh, you've given so much information for us today, for any listener to keep an eye out, but also to hopefully understand what might be happening with 1 in 200 children. It's like you say, it's not 2 in every classroom, but 2, 3 there'd be on average 3 in the school that my daughter goes to, the size of the primary school, and so often unidentified or identified very late, because parents and families have gone through years of trying to solve a problem that hasn't been identified by practitioners who just don't have the awareness. And like you say, it can take a long time for the understanding of these things to to move through medical profession, and this is helping so much.
Yeah, and some of these children have had a really traumatic kind of path, traumatic time. They were admitted to closed psychiatric units because their behavior was so unmanageable, and spent weeks or months there because nobody knew what it was, and they were just seen as, mentally ill
Yes.
and pumped full of medication that didn't help. So I have quite a few patients like that, where, if someone had just tried giving them some ibuprofen and antibiotic, they could have saved them years of suffering. And,
Yes.
can you imagine how traumatic it is for a young child to be in a closed psychiatric unit?
Oh, goodness, I can't even
It's
imagine.
just so sad.
Yeah, it's so sad and so very, very hard on the families, and it must give you great joy in your work to the relief that families must have when they get to work with you, and the change can come about so quickly when you've got the right diagnosis and the right approach. It must be absolutely brilliant to sort of be able to make that difference for families.
Yeah, it's very, very wonderful. I really love seeing that. Now, I have to say that there are some children who are not so easy to get well.
Yes,
The
yes.
severe end, they may need, other medications. They may even need some major immune modulation that can only be done in the hospitals. So it's not everybody recovers with 3 days of ibuprofen and
Of
a course of
course.
antibiotics, but the majority does. Yeah, the
Yes.
majority does. And if all of, those kids were treated, we would have a lot less suffering. I mean, since COVID, we've had such an increase in anxiety in children for many, many different reasons, right? For the lockdowns, the anxiety about people dying, and lots of different reasons. But I think we also need to keep in mind the brain inflammation, because COVID can cause that. Yeah.
Yes.
So, and that's why brain inflammation, neuroinflammation, and PANS are actually becoming more well known now, because it's very, very clear that some people after a COVID infection develop exactly these symptoms: post
Mm.
infectious brain inflammation. And and they also develop the symptoms of kind of what used to be called chronic fatigue or fibromyalgia, which used to be a little bit poo-pooed by the medical community. I think,
Yes.
oh, because it's mostly women who get it, must be in their minds. Not. And so, but now that we see it after COVID, there's a lot of research going into it, which is wonderful. So
Yes.
people are taking it seriously now. And these kids with PANS can have a lot of those symptoms as well. They can have pain all over their body or joint pains. They can have headaches, really severe headaches. So there's a lot of physical symptoms as well that they can suffer from, and that are relatively easy to resolve if you treat them right and quickly.
So you have so much expertise, and you're Sydney based, and you are sharing your expertise through your work with the Australian College of Nutritional and Environmental Medicine, which we refer to as ACNEM. And so that's helping to share your knowledge and your expertise. And so when parents or people listening are thinking, right, I need some help, where would you suggest? We've got some resources to refer them to, but in each state, is there a governing body that's national in Australia or in each country? Because I know you've worked and we have a global audience with the podcast. Where would you direct people to go to first to start to learn more or to seek help from wherever they are located?
So I think the PANDAS network.org is a really good way. There are some Facebook pages. So a lot of the families that find me through Facebook. Other parents recommending, saying, "Oh, my child has similar symptoms." So look on Facebook. There is an Australian group. There's the American groups, and then there is PANDAS network.org, which is a really good website. And then there's the PANDAS physicians network.org, and that's called PANS ppn.org. So that's more for doctors with lots of the studies on it. But I think even just going to PANDAS Network will give your GP the information they need to start treating this.
It is all there, and the information is readily available and easy for anybody to access. And I'll put all of those notes in the show notes for this episode as well.
Yeah, and I've written a blog. So if you go to my website, there's something on PANDAS. I've done lots of podcasts about it already, but this is the most up-to-date one. So this is the one you should be listening to.
Thank you. Well played. Yes.
And so the acronym course, which it's a workshop, it's 5 hours, 5 lectures on, for health practitioners, will be released in 2023.
Okay.
So if any doctor or health practitioner is interested in that, I think it's going to be very comprehensive and really give you the tools to pick up the cases and treat them. And prevent flares, prevent, it from happening again.
Yes, the person that recommended me so highly to connect with you, I spoke with her recently, and she said, "No, we haven't been to see Dr. Masson for a little while." And I thought, well, that's good. That's good, because that means that things have been traveling along okay. But if people wanted to work with you, do you work face to face? Do you do telehealth, or are your books closed because you're inundated with patients? Where are you at in terms of what you can offer?
So I work in Tamarama in Sydney and on telehealth via Zoom. I have a very long waiting list at the moment. So I have like 800 people on the waiting list. So it's going to be a little while. But I am training 2 other pediatricians in and doing the same work that I do. They're working with me, so they can be seen a bit quicker than I can. I'm also very, very eager to train more doctors.
Yes.
So if anyone is listening and would like to join and be trained in kind of nutrition and environmental pediatrics and how to pick up these kind of things about neuroinflammation and how to treat it, I would be happy to do that. And of course, through the acronym, I'm hoping to reach a lot of people who then can treat these children and the families. So it's, I think, in 10 years, everybody will know about PANDAS, but the problem is there are kids who are suffering right now.
Yes.
So who can't wait 10 years until everybody's heard about it.
That's right.
We need to spread that. There is a wonderful professor at Westmead called Professor Dale, who's doing research into PANDAS and some of the genetics and new medications. And he is doing research studies where he is recruiting kids as well to study.
Yes.
So there are other doctors in Australia for sure who have heard about PANDAS and who are, even more expert than I am. But overall, it is still, it's controversial because it's unknown. I feel like, when people say it's controversial, I say, well, it's just because you haven't heard. It's like, if I've never heard of a disease and, some experts, a dermatologist was recently telling me about a skin disease. I'd never heard of it. I wouldn't say, oh, I've never heard of it, so that must mean it doesn't exist. I said, tell me more about it. I haven't heard of that, So I think if everybody has that open mind to learn, and there is lots of research about it. There is also a really, really good group in America called neuroimmune.org. They put on a yearly conference and monthly meetings for parents and families, and also for health practitioners separately. And they're very, very good. They're kind of all the main people in America from Stanford University and all the big universities who do have PANDAS clinics meet there and discuss patients and the latest treatment. Oh. So there's a lot going on in the PANDAS world.
Yes. It's like a world that you don't know exists until you sort of set foot. I used to say that about cheerleading when my daughter did cheerleading. You'd go into your first cheerleading competition, you're like, this is unbelievable. I never knew this existed. And it is. And it's just conversations. It's just, I'm so grateful to the parent whose daughter is, I think it's her daughter, is a patient of yours, to say, because I say to people about the podcast, if there's something that you would like me to record an episode on, please just let me know and I will find somebody fantastic to talk to about it, because usually people like yourself are, it's very generous of you to share your time with us. And I really appreciate it, knowing how busy you are. But one conversation like this, where we spend 1 hour together, can have a ripple effect into hundreds of homes. And it's such a powerful thing to be able to do. And, so if people will open the conversation, the more we talk about these things, the more people get the information they need and get the help they need in a timely way. And that's such a big deal. I didn't have my anxiety diagnosed until for 20 years, and not
Wow.
before major clinical depression, which was hellish. And so that's part of what drives me. It's a huge part of what drives me. It doesn't
Mm,
have to be that way. And I know that
yeah.
that's what drives you in your work as well.
Yeah. I'm so glad that you finally got the help you needed
Yes.
and that you're
Oh,
spreading the knowledge now.
yes. Yes. Sharing the love, sharing the love.
Yeah.
Could you please share with us your website and how people can connect with your blogs and your resources that you share into the world? And I've been reading your blogs, and you're so clear and concise and open about these diagnoses and what things can look like when what ADHD can sometimes look like, and the different ways that different diagnoses can look like each other and what the differences are. So I really encourage people to jump on and have a look at the blogs and share them widely as well. So what's your website, and how else can people connect with your work?
So my website is drleilamasson.com, Leilamasson. And yeah, so as you said, there's my blogs on there, lots of information. I have some videos on there, which are kind of the basic things that I really recommend everybody do right, because you can't be happy and healthy if you don't sleep. So there's a
Yes.
video on sleep and the importance of it, and how to get kids to sleep enough and good quality sleep. You can't be happy and well if you eat a junk food diet. You need nutrients for your brain. Your brain cannot function on, I don't know, KFC and Coke. Absolutely not. So there's a video on nutrition and how to get kids to eat a healthy diet. Then there is one on lifestyle. So that's exercise. There's lots of research on anxiety, depression, ADHD, and the importance of exercise, and what a huge difference it makes, if a child gets an hour or two of outdoor exercise a day for their mental health. And then there's one, and lifestyle, of course, also stress reduction. Right. And
Yes.
this is so important for the kids with PANDAS, that they learn how to breathe. They learn how to just calm their brain down. Of course, we want to do all the things that we need to do to reduce the inflammation. But if a child can learn to, calm themselves down from a panic attack or something like that, that is super helpful. And
Uh,
then toxins, avoiding environmental toxins. So I already mentioned the lead poisoning, which of course isn't very common, but it still does happen. And there's lots of other environmental toxins like pesticides that would be really good to avoid. There's a pesticide called paraquat that is illegal in most countries, but not in Australia. And
wow.
it's very clearly associated with Parkinson, which affects the same areas of the brain as PANDAS. So I think if you can definitely not spray pesticides in your garden and in your
Yes.
house, so no fly sprays and so on, and try to reduce the pesticides on your food, that can be very helpful for your immune system and for your brain. So you don't have to buy everything organic, but there's something called the Environmental Working Group, ewg.org, ewg.org. And they have a list of the clean 15. Those are the fruits and vegetables that are pretty safe to eat, even if they're not organic, usually because
Yes.
they have a thick peel like avocado or banana. And then they have the dirty dozen, which you should never eat unless they're organic, because they're so drenched in pesticides. And lots of research on showing that kids, for example, with ADHD have higher levels of pesticides in their body compared to kids who don't have ADHD and things like that. So all that just to say that there are 4 videos on my website
Yes.
that everybody should watch, because they are just so fundamental for your physical and mental health. And I all my patients on my waiting list are, encouraged to watch those. And some come after, 6 or 8 months and say, actually, my child's problems are not so bad anymore because he's now sleeping and he's no longer eating all the additives and the high sugar diet he was on, and he's much better already. So that makes me happy when that happens. And then my book, I've written a book called Children's Health A to Z, which is a compilation of kind of all the most common illnesses and health issues that a child encounters in their childhood, throughout their childhood, and the most effective but natural approach to it. And also figuring out the underlying causes. Let's say if a child has constipation, what is it? Is it because they're not getting enough fiber in their diet? They're not drinking enough water because their gut flora is low, or they're not low in good bacteria, or they're not eating enough magnesium-rich foods that are important for constipation, those kind of things. And then I also, give advice on what you can do. So, but always trying to figure out what's happening. Why is this happening? So that's a book that you can get online. As a Kindle book, ebook, or as an actual book. And I think those would be the best things. You can subscribe to my newsletter on my website, and I have to say I'm not as good as I should be at sending out newsletters because I'm so busy, but I should. Every year I say next year I'm going to do a monthly newsletter, and then maybe in 2023 I'll manage to do it monthly.
Maybe one of your pediatric trainees can maybe contribute to a newsletter for you.
That's a good idea.
Yes, I think delegating that might be a nice thing to do, because yes, you have plenty of other people waiting for you, but it's something that I'm dedicating time to. But I did miss 1 month already. I missed September, and I wrote to everyone and said, look, I was away with my family, and I just decided that I wasn't going to really put myself under the pump to get it done. I took the holiday and took the break, and I was back in October. So, but there are so many ways for people to connect with you, and the reviews about your book on your website are outstanding. And I think it's such a gift. I mean, you are a gift on the whole, just in general, with everything you're doing. And that resource as a book is going to really support parents who can take steps and put measures in place to really support their children's health proactively, as well as in response to something that's happening, without necessarily having to, like in the example you shared, using a laxative that's treating the symptom but not treating the cause. And with your nutritional approach to medicine, and environmental approach to medicine, that there'll be so much gold in there. That I've got a 12 and a 14-year-old. Would it be suitable for me to have a copy for the children more in teenagers, or is it more for little kids?
No, I think it's still suitable because,
Great.
a lot of the things they will still get fevers and infections and headaches and mosquito bites.
Yes.
Acne.
Oh, yes. Oh,
it's all
great.
in there.
Oh, you are wonderful. Honestly,
and
thank
I
you
wanted
so
to
much.
also mention, I don't know why I forgot, but I have a Facebook page, Dr. Leila Masson, as well, where I'm also not sharing often enough, but there are, lots of posts that you can scroll back through that are some of them on anxiety and PANDAS, but also about lots of other things I'm interested in. All to do with children's health.
All to do with children's health. Thank you. And I've made a note of all of those, and I'll put all of those in the show notes, and we'll create hyperlinks so you can go to the show notes and just link straight through, or you can Google and find the pages hopefully fairly easily if you'd like to go straight from the podcast. But I just want to thank you so much for your time today. You have really shined, that's not even a word. You have shone a light. Is that the right way to say it? Shone a light. There's a really bright light shining now on PANDAS because of you. And I just feel so enlightened and really excited that this is information that's now available to my beautiful community and to teachers to take into their school communities to really make a difference for families and to save some families years and years of angst that could otherwise have been avoided. So thank you again for your wonderful work and for joining us.
Thank you so much for having me on your show.
Oh, thanks, Leila. And thank you for joining us. Thank you so much. Please share this episode widely so we can help spread the word and really support families who are really going through such a difficult time without the correct diagnosis for what's happening in their homes. And thank you again for joining me. And I very much look forward to being back with you again next week. Bye. Thank you so much for joining me for this week's episode. If you enjoyed it, please subscribe and leave a review. To keep the conversation going, I'd love you to join me over on Instagram. You'll find me at Dr Jodi Richardson. Also, if you'd like a copy of my free 5-day mini email course, Calm Your Anxious Brain, then jump over to my website, drjodirichardson.com, and you can sign up down the bottom. I've really enjoyed having your company. Thanks so much. See you next time.